Hello everyone! Welcome to this important session. Today, we're talking about a skill that has the power to turn everyday people into heroes. This skill is not just for medical professionals, it's for everyone. It's called CPR, and it stands for Cardiopulmonary Resuscitation. This technique is crucial in emergencies. Learning CPR empowers you to make a real difference in a life or death situation. It gives you the confidence to act swiftly. Imagine being at a park and someone suddenly collapses. It's a terrifying moment, but you can be prepared. Knowing CPR gives you the ability to step in and potentially save that person's life. Your actions can be the critical link in the chain of survival. Every second counts in a cardiac emergency, and your quick action can mean the difference between life and death. Time is of the essence. CPR is easier to learn than you might think. With proper training, it becomes second nature. With a little guidance, anyone can master the basic techniques. It's a skill that stays with you for life. In this guide, we'll break down the steps of CPR for both adults and infants, making it simple and straightforward. You'll learn how to handle different scenarios. So let's dive in and learn how to perform this life-saving skill. Your knowledge can be a beacon of hope. Together we can make our communities safer, one heartbeat at a time. Let's commit to learning and spreading this vital skill. CPR is a combination of chest compressions and rescue breaths that help to circulate oxygenated blood to the brain and other vital organs when someone's heart has stopped beating. When the heart stops, the body is deprived of oxygen, and brain damage can occur within minutes. CPR helps to buy precious time until medical professionals arrive. Each compression and breath you give acts as a manual pump, keeping blood flowing and oxygen circulating. CPR is not just for medical professionals. It's a skill that everyone should know. You never know when you might need to use it. It could be a family member, a friend, or even a stranger on the street. Let's start by learning how to perform CPR on adults. This is a crucial skill that can make the difference between life and death in an emergency situation. Remember, speed is of the essence in an emergency. Every second counts. Here's a step-by-step guide to help you act quickly and effectively. Step 1. Check for safety. Before you approach the person, ensure the scene is safe for both you and the individual needing help. This is crucial to avoid further harm. Look for any potential hazards like traffic, fire, or electricity. These dangers can put both you and the victim at greater risk. Step 2. Check for responsiveness. Gently tap the person's shoulder and ask loudly, "Are you okay?" This helps determine if they need immediate medical attention. If there is no response, they are unresponsive. This indicates a serious condition that requires urgent action. Step 3. Call for help. If you are alone, immediately call 911 or your local emergency number. This ensures professional help is on the way. If someone else is present, ask them to call while you begin CPR. Teamwork can be crucial in these situations. Step 4. Check for breathing. Look, listen, and feel for signs of breathing for no more than 5 seconds. Look for chest movements. Listen for breaths. This helps you assess their condition. Feel for breaths on your cheek. This can give you a clear indication of whether they are breathing or not. Step 5. Begin chest compressions. If the person is not breathing or only gasping, it's time to start chest compressions. 1. Hand placement. Place the heel of one hand in the center of the chest, on the lower half of the breastbone. Interlock your fingers and keep your arms straight. 2. Compression depth. Push down hard and fast, compressing the chest at least 2 inches. 3. Compression rate. Aim for a rate of 100 to 120 compressions per minute. 4. Allow complete recoil. Let the chest rise completely after each compression. This allows the heart to refill with blood. Section 5. Rescue breaths. Providing vital oxygen. Step 6. Give rescue breaths. Optional, but recommended. First, open the airway. Tilt the person's head back gently by lifting their chin. Next, seal the mask. If you have a CPR mask, place it over the person's mouth and nose. Then, give breaths. Pinch the person's nose closed and make a complete seal over their mouth with yours. Give 2 breaths, each lasting about 1 second, watching for the chest to rise. If the chest doesn't rise, reposition the head and try again. Section 6. Infant CPR. Adapting the technique for tiny hearts. Now let's talk about CPR for infants, those under 1 year old. CPR for infants is similar to adult CPR, but with some crucial differences. Step 1. Check for safety and responsiveness. As with adults, ensure the scene is safe and check the infant for responsiveness. Gently tap their foot and look for a response. Step 2. Call for help. If the infant is unresponsive, immediately call 911 or your local emergency number. Step 3. Check for breathing. Look, listen, and feel for breathing for no more than 5 seconds. Section 7. CPR for infants. Gentle compressions and precise breaths. Step 4. Begin chest compressions. Hand placement. Use 2 fingers, your index and middle, placed just below the nipple line, right in the center of the chest. Compression depth. Press down about 1.5 inches. Compression rate. Aim for the same rate as adults. 100 to 120 compressions per minute. Allow complete recoil. Ensure the chest rises completely after each compression. Step 5. Give rescue breaths. Open the airway. Tilt the head back slightly and lift the chin. Give breaths. Make a seal over the infant's mouth and nose with your mouth and give 2 gentle breaths, each lasting about 1 second. Section 8. Key takeaways. Essential tips for effective CPR. Knowing these can make a significant difference in an emergency situation. Here are some essential tips to remember. Push hard and fast. This is crucial for maintaining blood flow. Chest compressions should be firm and delivered at a rate of 100 to 120 compressions per minute for both adults and infants. This consistent rhythm is vital. Don't be afraid to push too hard. Many people hesitate, but it's important to apply enough pressure. It's better to err on the side of pushing too hard than not hard enough. The goal is to keep the blood circulating. You're trying to mimic the force of a beating heart. Allow for complete recoil. This means letting the chest rise fully. Letting the chest rise fully after each compression is crucial for the heart to refill with blood. This ensures effective circulation. Continue CPR until help arrives. Persistence is key in these critical moments. Don't stop CPR unless you see obvious signs of life, the scene becomes unsafe, you're too exhausted to continue, or an AED, automated external defibrillator, becomes available and is ready to use. Remember, every second counts. Section 9. The importance of practice and certification. The best way to be prepared for a cardiac emergency is to get hands-on practice. CPR certification courses are widely available and provide the opportunity to learn and practice these life-saving skills in a safe and controlled environment. During a CPR course, you'll receive guidance from certified instructors, practice on mannequins, and learn how to use an AED. Certification gives you the confidence to act quickly and effectively in a real-life situation. Section 10. Be prepared. CPR, a skill that can make all the difference. Learning CPR is an investment in the well-being of your community and yourself. It empowers you to make a real difference in a life or death situation. By understanding the steps involved and practicing these techniques, you can be prepared to act confidently and potentially save a life. Remember, CPR is a skill that anyone can learn. Take a course, practice regularly, and be a lifesaver.